Queensland authorities are on high alert this morning as they try to contain a COVID-19 outbreak in the state's southeast. 9 cases can now be linked to the cluster at a Brisbane Youth Detention Centre, and health officials say the next week will be critical as they try to monitor more than 40 locations visited by the people who tested positive.
Further south, Victoria's case numbers continue to trend down, and New South Wales Health says despite lower numbers there, the virus is continuing to circulate in the community. We've got Tim Swanston, Lily Mayers and Steph Ferrier all standing by with the latest. I want to go straight up to Queensland. Tim, with you, how far have the cases that have been linked to that youth detention centre outbreak spread now?
G'day, Lisa. Well, yes, we've got those 9 cases that are now part of that cluster, which really began a few days ago when a worker at the Brisbane Youth Detention Centre tested positive. Now we have a few other staff of that facility who have tested positive, as well as a few family members. In terms of the geographical region, though, Queensland Health are looking at a wide range of areas that they've now put out as part of a contact tracing alert. Just yesterday, they put out locations within Brisbane, as well as to the south of Brisbane, down in Logan and as far out as Ipswich. So for people who were at cafes, restaurants, shopping centres that are subject of that contact tracing alert, which includes dozens of locations, if they were there at that particular point in time and if they develop symptoms, that they should come forward and get tested. On that testing rate, though, Queensland's Health Minister Stephen Miles has said that the state really needs to up the ante when it comes to the testing rate. Seemingly in the last couple of days, that rate has dripped down to about 5,000, 6,000 tests per day, whereas what they were hoping at the last time Queensland saw a cluster like this, there was a testing rate of about 20,000 a day or so. So we're expecting an update from Queensland Health and the Premier within about an hour or so, where we're hoping to work out exactly if that cluster has spread, what areas may be affected, and if that testing rate has picked up. So if there's confidence that health authorities are picking up any new cases as they emerge.
All right, Tim, we'll keep an eye on it. Lily, you're in Sydney's northwest this morning. Where's the area of most concern for New South Wales at the moment?
Good morning, Lisa. Well, case numbers across the state have been pleasingly low in the last week. There is an investigation underway as to how 2 Sydney security guards contracted coronavirus while monitoring hotel quarantine. The Premier, Gladys Berejiklian, has defended the state's running of the hotel quarantine system. She has insisted that a federal audit has given her confidence the system is running well in New South Wales. So right now there'll be no change to the current protocols. There'll also be no change to the international cap on arrivals. 450 people per day is the current maximum, and the Premier has said if community transmission in the state continues to stabilise, she'll look at increasing that number. In terms of community transmission, we've been told there are cases still circulating. The government would like to see testing rates continue at a high level, and today we're expected to surpass 2 million tests in total since the pandemic began. So everyone in New South Wales is doing their best in terms of testing.
All right, and Steph in Victoria, how are the latest figures looking there?
Hi Lisa, yes, we're now at the halfway point of what feels like a very long 6-week stage 4 lockdown here in Melbourne, and the stage 3 restrictions, of course, in regional Victoria. But at least there are signs that our hard yards are paying off. We did go up slightly to 208 new cases after being down in the 100s for a couple of days, but at least the 7-day average is still going in the right direction. And in some encouraging news, our active cases are down for the 9th day in a row to just over 4,000. The number of people in hospital has also fallen below 600, and there are also fewer active cases among healthcare workers and in aged care, although 11 of the 17 deaths recorded yesterday were linked to aged care settings. Now, we are expected to hear a little bit more insights into exactly how this deadly second wave emerged when 2 more security guards give evidence at that independent inquiry into Melbourne's hotel quarantine scheme fiasco. And of course, in as little as an hour from now, we're also expecting to hear some of those new numbers from Victoria. So let's hope that they continue in the downward path.
Thank you to all of you for bringing us up to speed.